of norepinephrine, serotonin, and dopamine in the brain. And it's used for depression that is resistant to other medications. So the key points for MAOIs is just the acronym MAOI. M for massive hypertension crisis risk. Usually a key sign is a massive headache. So we avoid the tyramine. Now that's an amino acid that helps regulate the blood pressure and actually triggers hypertension crisis, leading to death from a heart attack like an MI or a CVA stroke. So guys, the big no-no list to avoid. So no fermented alcohol, fermented fruits or veggies, and even meats. So number 1, wine and cheese. Guys, no, so no wine tasting. Number 2, beer and sausage and salami, no beer fests. And number 3 is chocolates. Guys, no visiting Charlie or his chocolate factory. We are teaching patients to start the diet at least 2 weeks before starting MAOIs and continue for 2 weeks after stopping. So the memory trick is tyramine, ends in I-N-E, like phenelzine. Just think tyramine, or selegiline is tyramine. So no cheese, beer, sausage, or wine for tyramine. So big questions on the exams here. Can the patient eat fruit? Guys, yes. Can they eat veggies? Yes. Can they have fermented fruits or veggies, or even pickled veggies? No. Dried processed fruits? No. What about liver, tongue, sausage? Guys, these are all meats. So no, they cannot have it. Now, O is for OTC, or over-the-counter drugs. And this could contribute to a hypertension crisis. So guys, we avoid can. C for calcium, A for antacids, A for acetaminophen, or basically Tylenol, and N for NSAIDs like naproxen and ibuprofen. Now our next O is for other antidepressants to avoid. Guys, remember, MAOIs do not mix with other antidepressants. So we're avoiding TCAs, SSRIs, SNRIs. This can actually trigger a serotonin syndrome. So we have a 2-week washout period when changing or swapping out antidepressants. Guys, 2 full weeks, not 2 days, not the day before, 2 weeks from the ending. Keyword is fully taper off the other. So the big key point is no escitalopram, which is an SSRI, and no imipramine, which is a TCA. Guys, the NCLEX will try and trick you, so just make sure to know the names of these drugs. Now, I is for increased suicide risk, usually within the first few weeks of treatment or when the dose is increased. Now, this especially happens in children, adolescents, and young adults. So the key words to write down here, guys. Patient states this med is not working after 2 weeks. The first thing to do is assessment, guys. So further expressions of hopelessness, despair, or suicidal thoughts or harming themselves usually indicates a reason to report to the HCP.